So you guys are going to get hopefully a good dose of exactly what inflammation is. What is it really? You're going to learn a couple things tonight. Our hope is that you understand these three big things. Understanding what the causes are, why it's important to be aware of it and manage it. You're going to learn natural strategies to help reduce it, hopefully. And we're going to assess your own health as it relates to inflammation and setting goals. So that's the where we're going to go with this. So inflammation, there's basically two types. Well, we're going to dig into this. Your inflammation, it's really just your body's natural way of protecting itself. Ultimately, your body is built amazingly to try to protect you from bacteria and toxins. If you get hurt or sick, your body is going to produce an inflammatory response to wall off bugs, to kill bugs, to repair tissue. That's what your body's inflammation response is for. This is going to cause redness or swelling. It's going to be warm usually if it's really intense. It's going to usually have pain. If you get a cut, or if you have infection, you get red and puffy. So your immune cells are doing most of this repair work. That's ultimately what it is. It's your immune system doing this repair work. The challenge is when it's going overboard. So Dr. Mark Hyman up in Cleveland Clinic, a big proponent of functional medicine and nutrition, he said this, I think this really sums it up, that inflammation is your body's natural defense system, and it could be a good thing. So you hear so many bad things about inflammation. So you would think if it's so bad, why don't I just take an ibuprofen my whole life as like a prophylactic? You shouldn't. It's not a good idea at all. But it is a good thing. However, systemic inflammation can cause your immune system to shift out of balance ultimately. And when that is out of balance, what's going to happen is going to lead to one of the major, pretty much every chronic disease that there is. Heart disease, diabetes, cancer, obesity. These are the diseases of aging. Your body has a blueprint. It was built with an amazing blueprint. But when we are subluxated, when we are altered, then our body is decaying and deteriorating faster. And chronic inflammation is one of these irritants. So let's dig a little bit into the two types. I've been saying this a little bit, but inflammation, it is a good thing. We want it. But in a chronic and systemic way, it's not a good thing. It leads to pretty much all chronic disease. So there's two types, acute and there's chronic. The acute is what you would expect to see when you get bit by a bug. If you catch a cold, your body's fighting off bugs or viruses, or you have an acute injury, your body's going to inflame. It's going to be sore and swollen, but then the body's going to heal and repair. It's going to get rid of that bug. The second type is that chronic inflammation. This is when your body's inflammation response, it stays on for too long. It doesn't just ramp up and ramp down. It's never being turned off. We're going to get into why that is a little bit. But ultimately, a poor diet, stress, long-term conditions with like arthritis is going to be helping add to this, fueling the flames of chronic inflammation. So the acute symptoms of it, again, are that flushed skin, mild pain and tenderness, swelling, hot skin, reduced range of motion. This is what happens when you have an injury. This is your body's way of protecting you, slowing you down so it can repair and heal, to get rid of infections or bugs. But chronic inflammation is not an infection of your body. It's increased inflammation that goes throughout your whole body. So let's look at some of the chronic symptoms. I love the pictures more than anything, but just know that the abdominal pain or chest pain, that means chronic heart disease. Ultimately, it could be fatigue, joint pain, rashes, skin issues, chronic skin issues. Mood disorders can be chronic inflammation, brain inflammation. We call that neuroinflammation. GI issues, weight loss, weight gain can be a chronic symptom, but obesity definitely can add to it. And you can see some of the pictures, but these things are issues that are chronic inflammatory diseases and symptoms, I guess, of those. 60%, and that's the number of people worldwide that die specifically due to chronic inflammatory diseases. So chronic inflammation, chronic conditions, ultimately chronic pain and chronic problems are at risk for majority of deaths in the whole world overall. And that's a crazy thing. So let's talk about some of the factors here. Chronic stress is one of the highest. I mean, I just had a fellow today. He's a young guy. He's definitely under 50. He's at the doctor and realized that his blood pressure was high. So he decided to monitor it. It's still high. So now he's saying, what do I do? He wants to start making some changes in his diet. And he knows that. He started working out more, and that's going to help. He's, I said, hey, ultimately, if your blood pressure is high, especially on the systolic reading, your top reading, that typically means that your brain or subconscious is under such stress that it's pushing attention through your whole body. And the only way that we're really going to bring that down and tune that down is through trying to reduce chronic stress. And he said, oh yeah, there's a lot of retraining I'd have to do there. He admitted that. So knowing that probably the hardest thing to retrain, as much as I love that Snickers bar, or I'd like some ice cream at the end of the night. That sounds tricky to deal with. Try dealing with turning off our brain's constant message to your body that it's under stress. That's even harder. But if it comes from that, it's either you choose changing that or having a chronic disease. It really becomes one or the other. So chronic stress is on the top because it's probably the hardest to deal with and probably the most prevalent. Diet and gut health. What you're putting in your body and how your body's dealing with it is going to cause more inflammation or it's not. And of course, exposure to toxins. Some of these we can choose. We can stop drinking. We can stop smoking. But you have to breathe. You have to drink water. You have to eat some food. And so that's where most of our chemicals come from, or water, food, and air. If you're adding them to your diet, then there's reasons. You're trying to get rid of some pain somewhere. That's just the truth of the matter. But this is some of the most biggest factors that are going to affect inflammation. Victoria's here to support me, not just stand there. If you want to just share your journey a little bit, maybe we should just start with your journey of chiropractic and, your just journey of health and how that kind of relates to probably all these things.
Well, I can relate to all of these, as I'm sure most of us can. But the big thing for me was always chronic stress and those thoughts in my head. So if you have all of that, I highly recommend finding a very good counselor that you can connect with to help unpack some of that. It's not easy. I can tell you from experience, it is not easy to unpack that stuff. But boy, the light on the other side of that, when you reach that bottom and you come back up and you realize you're never going back there again, is huge. So that just in itself is big. There's still struggles. It's not like I'm magically cured, but it's easier for me to manage now that I've unpacked a lot of that. But then it goes into the eating well. I'm a stress eater. When I get stressed, give me chocolate, give me ice cream, give me fast food. That is always my go-tos. And I knew I turned 40 last week, if everybody didn't already know that. And I knew that I had to make big changes before I turned 40, because once I turned 40, I knew it was going to be even harder. So really the past 2 years, I've really tried changing what I eat, how I move my body, and the Shape Reclaim program really helped me with that. If you guys want more information about it, we can give you the brochures and we can talk to you about it. But it's just these homeopathic drops you take 3 times a day. You really eat clean for a period of time that you determine. The longest I did was probably 3 months, pretty hard. And that was last year. When I did that, I actually finally found the energy to start exercising regularly again. And I'm happy to say that even though it's not as regular as it used to be, a year later, I'm still exercising regular. I never thought I would be able to say that in my life because I'm not an exercise person. I hate to move my body. I hate to eat good because I go back into those old habits. So I'm a work in progress, but I've lost weight. I've lost tons of inflammation. Since I started working here almost 3 years ago, I've lost 40 pounds at least. Probably a little bit more than that. My inflammation is amazing. And the way I can tell that is my joints don't hurt. I sleep better at night. And when this guy adjusts me, everything moves. Where before there were certain parts of my spine you couldn't even get to move. You could have used a jackhammer and they wouldn't have moved because of all that inflammation and holding all that tension in there. So there's a lot of changes I've made over years. And I'm still trying to make changes every day. But just remember, every day is a new day.
Today is the first day of the rest of our life.
Right. And so it's never too late to just start doing things and trying to make yourself a little bit better. It's not going to be perfect. There's no such thing.
The idea is that Victoria's put lots and lots of effort, and there's times it's easier to make good choices, and there's times it's been harder. And over every day, you're making choices that are basically bringing you toward a healthier balance or healthier place, or taking you away from it. No one can just hold their health. Some people will say, hey doc, I'm feeling better. Things are getting crazy. I don't know if this is really, I have the time anymore to come here 3 times a week. Can we just put it on hold? Or you can't just kind of hold progress. You can't just hold attention that you've been putting to things. If you stop doing the things that are maybe uncomfortable, and you go to the comfortable, that's where things go to die. And we just heard that if you want to get gruesome, and we're talking about chronic disease, when we were comfortable, that's where we go to die. I mean, ultimately, that's maybe more than we're going to get intense with this. But when we make the easy choices and the comfortable choices, our body is probably not leading to the higher levels of health and healing. Let's see what else we get going on. Inflammation. Food is medicine. That's our SHAPE program. If you don't know where to start and you're ready to put effort and time into at least a 3 or 4 week process and you want support, the SHAPE program is the way to go. If you're like someone that says, hey, I like to do it little bits at a time and I'm very diligent, I'll keep adding 1% of change every day and I'm going to land in a different place for my health than I would have if I hadn't, then we can give you some info that says, hey, I would just at least buy our 30-day anti-inflammatory book. It's like kind of a do-it-yourself thing. And if you say, hey, I need a little support, the drops are what you want to buy too with that. But those things are going to help. So food is medicine. Yes, there's definitely lots of ways to eat anti-inflammatory. We can give you handouts, lots of different things. So ask us. Supplements. Omega-3 is probably the best research product that's out there that you have. There really hasn't been too much negative press on, but fish oil, it's what we call omega-3s. You can get them from walnuts. You can get them from lots of green vegetables. Your olive oil has it, but omega-3s are huge. If you can increase your omega-3s in your diet and decrease omega-6, which is all the plant oils, the fried oils and just fat, like if you're eating fast food, that's pretty much all omega-6. If you have way more than that, then the omega-3s, which is fish, green leafy vegetables, nuts and seeds. If you're way out of balance there, then make those choices. That's the supplements. Zinc is very important for everyone, but it's important to have good combinations of what you're taking with your zinc. So I won't go any further with that. Movement, at least aim for 30 minutes, 5 times a week. And so search to move your body to get the blood flowing. Patients that do 2 things in my office at a significant level, I'm not talking once in a while. I'm saying they've made a commitment to do it most times a week. If they're eating an anti-inflammatory diet most times of the week, they get on my table and they adjust like a whole different person very quickly, within probably a week or 2. Or they say, I started getting back to the gym and moving my body. I don't even care what they were, like how they were doing. If it was a rowing machine or just walking or they were doing some sort of HIIT workout, whatever they were doing to move their body, they adjust better. They got blood flow to muscles and joints that weren't seeing the intensity of blood and that healing process for a while. So movement and diet are probably huge, which this is nothing new to anyone. But chronic inflammation is going to affect 60% of our world. And if you're not doing something to reduce your inflammation, that means you're probably increasing it. Basically the fact, right? We're going to do a health assessment, okay? Just right now, if you have a piece of paper, great. Do you have pain, swelling, or stiffness? Do you wake up in the morning and try to make a fist and it's hard to clench that versus maybe throughout the day it's looser? Get up in the morning, do the stiffness test. If you're really stiff, hard to move, probably chronic inflammation. Chest or abdominal pain, indigestion, any kind of digestive issues. If you got bloating or gas or pain, I'm sure there's some sort of inflammation and a lot of myriad of issues when it comes to what foods you're eating and how your body's digesting them. Do you have soreness or rashes? Do you have skin issues frequently? Do you have frequent infections? It means your immune system has been working way too hard. And inflammation ultimately is kind of subdued certain things, so your body doesn't have the energy to fight things off. GI issues, diarrhea, constipation, acid reflux, unexplained weight loss or gain, and depression, anxiety, or mood disorders. Mood and food are so connected. If people could just balance their blood sugar with more fiber, eating more times a day, eating the foods that are not going to just spike your blood sugar, you'd have a more calm and stable day. I guarantee. And you wouldn't have to go on Lexapro per se. Let's do one more thing, factor assessment. So I want you to say, hey, do I have low physical activity? Am I not moving my body 30 minutes every day? Purposely, am I not getting 10,000 steps a day? If you're not market, chronic stress. Do I feel I have chronic stress? Do I have excessive weight on me? Is there a toxic weight that I need to get rid of? Are you eating foods high in salt or trans fats? Most things that are packaged or processed have one of those things, if not both. If it's in a box, it can rest on the shelf, not be on the outside of the grocery store. It probably has something in there. Mark that category. Is your sleep disrupted? Do you wake and not feel energized? Even if you get 8 hours or 10 hours, it doesn't matter. Do you drink excessive amounts of alcohol? Do you expose yourself to hazardous chemicals? Are you exposed? Maybe your job, you are. So those are the factors. So basically symptoms you have and factors. Mark those. There's some actions we're going to take. So I want you to say, hey, I'm going to commit to increasing my physical activity, or I'm going to commit to eating more green leafy vegetables in my diet, or I'm going to try to quit smoking or limit my alcohol. I'm going to start incorporating stress reduction strategies. The strongest pharmacy on the planet's inside your brain. And if you can tap into your brain and allow it to do the work, you can feel better. You can think better. You can feel better. You can have less inflammation. So all these aspects that we're talking about help you to have your brain chemistry reduce it, to produce when it needs to.